A laughing baby, toys scattered across the floor, and a constant supply of yogurt melts and snacks. Stephanie and Chris Goulding are living the life they dreamed about. But it wasn't always this way. In 2022, the couple was expecting their first child, a daughter named Macy.
We had picture perfect pregnancy. It was, my OB he just said, I can't believe you haven't had any issues and everything is great. And so we, of course, went into the delivery room expecting the exact same outcome. But unfortunately, it didn't work out that way.
Stephanie was scheduled to be induced. As the date got closer, problems started to arise. She went to the hospital with high blood pressure, and doctors asked if she wanted to have her baby today. The couple said yes, they were excited to see their newborn baby, but the induction didn't work. She was rushed into an emergency C-section.
After the section, it was just silence. We didn't hear a baby cry. We didn't hear any of the things that we knew we should be hearing. And basically, Macy was whisked away.
They were expecting to hold a newborn baby. Instead, they waited.
We waited for almost 2 hours for a doctor to come out and visit us and tell us what was going on and where Macy was. Because we had no idea what was happening. And it was about 2 hours later they came out and the doctor just said, Macy is sick. And we didn't know what sick meant. And it was at that point that the nurse looked at us and said, do you want to get her baptized? And that's when it clicked into us.
That she wasn't coming home.
We found out she had heartbeat for 10 minutes after birth at that point. So she was brain dead.
Stephanie and Chris Goulding said goodbye to their daughter on the same day they welcomed her. Then they were placed on the maternity ward to recover. Every new family walked past their hospital room. When it came time to deal with their grief, they expected help. What they got were pamphlets and grief counseling at the hospital chapel and a referral to a perinatal psychiatrist.
It wasn't good enough. It absolutely was not good enough. When I did see her, she was absolutely lovely. However, I needed something more intensive than once a month virtually.
The couple pursued private counseling, but they didn't give up hope.
There were months where I couldn't get out of bed, and what got me out of bed was knowing that eventually we would have him.
Dr. Vidya Sanker is Newfoundland and Labrador's only perinatal psychiatrist, and she is the chair of the province's Perinatal Mental Health Alliance. She said 28% of women in the province, among the highest rates in Canada, experienced perinatal mood and anxiety problems. Every month, she receives over 24 referrals from Newfoundland and Labrador Health Services.
So we're missing a lot of psychological supports, a lot of group environments, as well as peer-to-peer support, really focused on perinatal mental health. But as we're doing more awareness campaigns and information and education is getting out there, we're still challenged with the lack of resources that are available to help treat individuals. And so since the services are MCP covered, we do get a lot of referrals that can make it difficult because not everyone needs psychiatry.
That's why Karen Clark opened up a private practice, open book doula and counseling services in Mount Pearl. Clark and her husband experienced a miscarriage before having her son 6 years ago. The two experiences opened her eyes to the lack of support for parents.
You just don't know what it's like until you're living through it, exactly what it's like, right? Like, people can talk about it, but once you live through it, you kind of understand it better.
The typical perinatal period is preconception to the baby's first birthday. But Clark works with a different definition. From preconception, the moment parents decide to start to try for a baby, to the child's third birthday.
And then the reason why we extended up to 3 years is because infant mental health is defined as the first 3 years of the baby's life. Okay. And infant mental health's main determining factor is parental mental health. And so we look at the mental health of the parents during the perinatal period as the biggest determining factor.
Clark says to take care of a child's well-being, then the well-being of the parents need to be prioritized.
Life as a mom is beautiful and wonderful and the best thing that's ever happened to me. And that's the thing, is that the hardest things in life are often the most beautiful parts of life, right? And us in society, we tend to only give parents permission to talk about the positive parts of parenting, right? Whether it's explicit or not, a lot of us go through our experience in parenthood believing that it's only okay to talk about the positive thoughts, the positive feelings, and the positive experiences. And boy, there's a lot of those to talk about, right? But just like everything in life, nothing is only positive. There's positive and there's negative. There's up and there's down. And even in the challenging parts, we can find great value, and there's things that come out of those challenging parts that we're grateful for, and they're hard. And what I always say about parenthood is that it is the full spectrum of emotions, the full spectrum of thoughts, and a full spectrum of experiences. Being a mom means feeling every feeling and a few others we haven't discovered yet or identified yet. And while it's the most beautiful thing, it's also the most difficult thing, and that's what makes it wonderful.
More parents struggle with perinatal mental health in this province than any other. That's why the Perinatal Mental Health Alliance formed in 2020, and why parents like Stephanie and Chris Goulding say more help is needed. Jenna Head, CBC News, St. John's.